Hi, I'm Dr. Durkin. I want to talk for a few minutes about flashes and floaters. First of all, a lot of people call our office experiencing an onset of new flashes or floaters. Flashes would look like a bright camera flash in your vision, or like someone was shining a flashlight over to your side. And floaters are little dark specks that kind of move around in your vision. Uh, we always recommend that anyone who has a sudden onset of flashes and floaters would come in for an eye exam to check and make sure that there's no serious issues like any kind of retinal tears or any bleeding inside the eye. But the majority of people who have floaters just have a few of them. They aren't all particularly that new, and they just kind of irritate them because they see them in their vision when they move their eyes. This is what one of those floaters can look like. If we zoom in on this picture here, we've got the optic nerve, and then this little dark shadow here is the floater. And what that was most likely a thicker area of the gel that fills the inside of the eye, the vitreous, that kind of released and pulled off and kind of sits here. And it floats, so if the eye moves, it actually goes back and forth like that. Those kind of floaters, when we don't have any type of retinal disease or retinal tears, is pretty benign. It's more irritating than anything else. And those typically aren't something we would be concerned about. But sometimes you can get new floaters where you see a whole lot of them, like hundreds or thousands or billions of them. And those sometimes are due to a broken blood vessel in the retina that causes blood to leak out into the eye, or from a retinal tear or detachment. And anything that's new or troubling like that, where you're seeing something that you don't normally see, especially if there's any vision loss involved, would be something you'd want to get checked out, usually within a day or two, just to see if everything's okay. And of course, if you have any questions about it, you could always call and talk to one of our staff and see if we can get you in to evaluate that. What I have here is a photo of a retinal detachment taken with an OptiMap imaging device. The OptiMap is used to get a wide-angle picture of the retina. When someone comes in who has flashes and floaters or other symptoms of potential retinal issues, most often we'll have to put drops in to dilate the pupils so that we can get a good look inside the eye. But we'll also take a photo like this that can help show us things in the broad grand scheme of things, like a wide angle view. This is a retinal detachment. It's a pretty big one. The retina is detached all the way from here down to there. There's fluid that got underneath, and this is kind of peeling backward like a wavy sheet of cellophane or a fabric. Someone who has a retinal detachment like this will often see like a blurry area in their vision that looks like a cloud or a veil or something like that. And it's usually pretty striking when that happens. You might put your fingers up and only see them in one part of your vision, not over here, vice versa. Of course, if you have any kind of persistent loss of vision anywhere in the periphery or centrally, you'd want to let us know as soon as possible.